Hello there, folks. My name is Ben Spagan. I'm the vice president here at the Jefferson Educational Society. And of course, because this is a lunchtime program, I'd invite you to continue to get your refreshments, settle in. What I'm going to do is go through a few housekeeping notes before I introduce the moderator of today's panel to dive into our discussion here today with the JES's Civic Leadership Academy cohort of 2024, which focused on mental health. We'll get into that just in a moment. But to those housekeeping, if you need any help during this event, please do not wait. Come and find one of our team members, our volunteers. Raise your hand. We are always happy to assist you. We want to make sure you're getting as much as you can out of these events and that nothing is getting in the way of your learning opportunity. We will have time for questions afterwards. For those who have been with us before, you know the drill. We ask that you raise your hand. One of our helpful team members will be around with the microphone. We ask you to wait for the microphone. Some folks may be using hearing-assisted devices. We want to make sure that everybody has a chance to hear your question. And of course, my favorite kind of questions, and I hope they are yours too, they are just that, questions, not lengthy statements, not your dissertation on a topic. Try to keep it as brief as possible because we do want to have an engaging back and forth between you, the audience, and our wonderful panelists here today. Now, this event officially closes out this week of the spring term programming. If you've not yet picked up a copy of the brochure, this has all of our events in it. You can find those in the back of the room, in the front office. It details all of the things to come, including we will have programming next week starting Monday. We are doing a series in which we're celebrating the bicentennial of Lafayette's journey, the Marquis de Lafayette's journey through America, his farewell tour. And of course, part of that farewell tour included a famous dinner here in Erie, Pennsylvania. And if you didn't have the chance, you might have missed the one here. I wanted to thank the Hagen History Center. I saw Adam here. We had a tablecloth from that very dinner that is on the archives, in the archives of the Hagen History Center. I invite you to go see those things there. Richard Arthur, who is leading that series with us with wonderful support from our Decadian scholar, Dr. Judy Lynch. Richard is offering a program at our satellite location in Fairview. That is in the Lincoln Community Center, the library out there. That's at 6 p.m. Lafayette, Founding Father, an American Citizen. That is free. We do ask advanced registration because it is limited capacity in that venue space. Tuesday, coming back to the Hagen History Center, we have a wonderful partnership with that organization. We've been running a wonderful series, the Doris A. Becker lecture series. The next installment is going to feature Kimberly Montag talking about the trinity of American architecture, Richardson, Sullivan, and Wright. Of course, Wright being important to us with the exhibit at the Hagen History Center, his influence in this region and beyond. That's at 7 p.m. on Tuesday. Wednesday, Dr. Judy Lynch, who I mentioned already, she wrote a wonderful book, a comprehensive history that is just as densely packed with facts and interesting tidbits as it is accessible. She is on a bit of a book tour focusing on some of the regions. She will be in Harbor Creek on Wednesday, talking about the economic history of northwestern Pennsylvania, focusing on the Harbor Creek chapters. We invite you to that program at 6. Thursday next week, U.S.-Canada Relations and Comparisons. Dr. Robert Spiel, a professor at Penn State Barron, will be offering that. He's just written a book on this. So I love when I can introduce programs and say, and this person literally wrote the book on it. We will have copies. We hope they are in the mail. They are trying to make their way from Canada to the U.S. We're hoping they get here in time. There will be a book sale and signing if they make it. And then on Friday, we have another community conversation. That one's not happening here. Why? That one is about the food hall. It is a tour of the food hall downtown to look at the economic development and revitalization run through an organization like that. Drew Whiting, the executive, the CEO of the Erie Downtown Development Corporation, will be leading that tour. It starts a little bit earlier. Details in this brochure. I've talked way more than you probably wanted me to, but those are important things my team tells me that you all need to know. So now that you know them, it is with great pleasure that I get to introduce today's moderator to introduce the panel. And I say that because of the many things that I have the opportunity to help out with around here at the JES. One of those is the Civic Leadership Academy. I was so honored when the team turned to me in 2016 and asked me to direct that. I took a break for a few years to help out with a few other initiatives, and when the opportunity arose to go back to this, I immediately leapt at it. The reason being is I really do think that we've created something special here, a unique opportunity, a learning opportunity to know local government, state government, its relations, but also a networking opportunity to bring people that may not always see eye to eye, but can stand shoulder to shoulder and learn more about their community. They can dive into research and actually produce clear-eyed recommendations that have actionable impact, not just in our community, but have the opportunity to scale into other communities and have an impact way beyond that. If it sounds like I'm making a sales pitch, perhaps I am. We are nearly wrapping up the recruiting for the 2025 cohort. I see some applicants, some prospective applicants, folks who have already been admitted here today. If you're curious about that, I get to direct and facilitate that with my outstanding colleague, Chelsea Oliver. See one of us for more details, or if you know somebody in your orbit, let us know. We are wrapping up that recruiting. But here, to dive more deeply into the critical research around mental health, talk about their process, what they learned along the way, its implications, and the recommendations that they have to offer, are a representative panel of our entire cohort that was nearly 30-some people last year. To introduce our panel and who will moderate today's conversation, please join me in issuing a warm JES welcome to Sarah McCall of the Erie County Public Library System. Sarah.
Thank you, Ben, and thank you everyone for being here today. We're proud to share the work today of the 2024 JES Civic Leadership Academy cohort and the focus of our project, improving access to mental health care for teens in Erie County. From the beginning, our mission was clear. How can mental health care in Erie County become more visible, more approachable, and easier for teens to access?
A little bit closer to the mic, please.
Thanks. Sorry. We know that when young people's mental health is supported, they're more likely to succeed in school, in relationships, and in life. But many teens in our community are struggling, and they're not getting the help they need. Our team took a deep dive into this issue. We used a mixed methods case study approach, combining local and state data with interviews from professionals on the front lines of youth mental health care. We asked, what's getting in the way of access, and what can be done to break down those barriers? From our research, Erie County teens continue to face mental health concerns at rates above the state average. More than half of adolescents don't receive the mental health care they need. Nearly half report feeling sad or depressed most days, and more than 1 in 6 reported self-harm. Alarmingly, suicide attempts that required medical care have increased in most age groups. At the same time, fewer teens are using available services, even though a wide variety of public and private providers operate in the region. This tells us that availability alone isn't enough. Barriers like unfamiliarity with services, stigma, financial stress, cultural pressures, and complicated insurance stand in the way. Locally, we believe Erie County must move toward a standard of care that's consistent and coordinated across providers. Without strong communication, youth can fall through the cracks, even when services exist. That's why our top recommendation is simple but powerful. We must improve how we communicate and coordinate across all mental health systems in Erie County. We're excited to share more with you through our panel, which will be discussing solutions and recommendations we've developed, including an action already being implemented in our community. We'll also dive deeper into how you, as a community member, can begin to take action yourself to support Erie County's youth. When providers, schools, families, and leaders work together, we can close the gaps and make sure no teen is left behind. It's my privilege to introduce today's panelists from the 2024 cohort, Dr. Nancy Morris, Next Level Innovation Consultant at Erie Insurance, representing the research team. Shatiria Franklin, founder of the Destiny of Our Daughters, Incorporated, representing the writing team. Gabe Janua, social worker, representing the review team. Kyra Taylor, co-founder and executive director of Erie's Black Wall Street, representing the design team. Kat DiVittorio, assistant director of the Corey Higher Education Council, representing the presentation team. And Kenneth Stevens, producer for WQLN PBS's Chronicles, representing the organization team. Shatiria, would you be willing to start us off and tell us what are the most significant barriers to mental health care in Erie County?
Yes, thank you, Sarah. So we found quite a few barriers. Sarah mentioned a few in the beginning, but we wanted to just highlight stigma, financial stress, cultural pressures, complicated insurance, and then being unfamiliar with what services are available. We know, for me, what stands out the most is stigma, cultural pressures, and financial stress. When people think about mental health services, often youth, they don't even understand what that is. They don't want their friends to think that something is wrong with them. The cultural pressures that they face of, hey, I'm having an issue, and being able to communicate that issue effectively to the people around them can be quite pressuring, and it will allow them to go inward and not share those things, creating a bigger mental health issue. Insurance, of course, is extremely complicated, which we know, and what that financial burden can be to a family who is already experiencing burdens enough. So when we talk about mental health, and we just want to highlight these barriers and what we can be doing better to understand how we can overcome, especially the stigma, and creating more safe conversations around what mental health actually is.
I believe what enabled us to identify such a range of factors in our research has to do with the range of people involved in our work. Gabe, would you be willing to discuss what qualifies this year's cohort in particular to discuss this topic, as well how this cohort built on this by reaching out to local experts during our research?
Yes. Okay, so I had to make sure. It is echoey. So our cohort was made up of a wide variety of professionals, but what I think qualifies us in particular to discuss this is our relation to the topic in the way of some of us are parents to older children, some of us are parents to younger children, some of us never want to be parents, but were at one point youth, and some of us are still youth today. So I think that our range really qualifies us. But something that I found particularly interesting that helped our study is the range of what we all knew about mental health and the mental health field. So all of us came into this and we knew, okay, mental health is something that everybody struggles with, and it's a big issue in Erie, but the way in which we were related to it was something that was shocking to me, because I came into this and I was like, okay, I'm going to be sitting with a bunch of therapists who already know everything. And then Chelsea was like, no, that's not true. And I was like, awesome, now we get to talk about it. So a lot of it was the people in the field educating people who aren't in the field, and I think that helped our study because it really got us thinking of what the general population knows and what they don't know and what we really need to focus on. So our education, as we learned, and just us being us, I think, is really what helped us to be qualified to talk about this.
Kenna, given how broad the topic of mental health could have been, could you expand on how we chose the demographic limitation of 14 to 18? Why did we decide this group was important?
Absolutely. So mental health, that was the subject that we were given, just mental health. Anything in the field range of mental health, which is a massive subject to narrow down. So it was kind of difficult to figure out, okay, where can we make the most difference? What makes sense to research and pursue? And what were we interested in? What would motivate us to want to pursue this research? While we were in those early stages of figuring out exactly what this research was and was going to be, we had several meetings, including one with one of our mentor figures through this process, Pat Cuneo, who asked us as a cohort, where is the biggest crisis? Where is this unaddressed need and what is achievable for this group to make a difference in. And so in our conversations after that, one of the places that we saw a significant need, especially in the Erie area, was in teens and their interaction with the mental health system. So we had some thoughts that maybe, okay, do we focus even more specifically on kids in the foster system, because there are a lot of unaddressed needs there. Teens have a lot of those very specific needs as well when it comes to their particular mental health in school and going through puberty and all of those factors in there. But what was very interesting about this 14 to 18 age group was they're in a period where they're preparing for their transition to adulthood and leaving child care services and services targeting children specifically, and then entering the field of services for adults, which is an entirely different system with entirely different processes. You might not even be able to keep the same therapist, for example, in the context of mental health. And a lot of kids are unprepared to make that transition into adulthood. They don't know how to access their own insurance or their parents' insurance, or they don't know where these resources are that could help them, could serve them. And with the state of mental health, especially in Erie County, of youth, there was this crisis, this significant unaddressed need that we could make a difference in assisting, that it was achievable to be able to make a difference and a significant difference in the lives of the people in our community. So by specifically focusing on that group of kids preparing for adulthood, of youth, young adults. I mean, if you're 18, even if you were not technically able to have your own insurance yet, you're still a legal adult and can make decisions at that age of majority of being 18. You may be moving out to go to college. You may be moving out to start a job. You may have all sorts of these different factors that impact your ability to care for your own mental health. And so there's this need that we can potentially start the process in helping to fill.
To narrow in even more specifically, we see this term come up in mental health and health discussions a lot. What does a youth-centered mental health approach look like to you?
So I'll take this one first. A youth-centered mental health approach is literally just that. It has to be youth-centered, meaning that they have to be involved in it. Too many times decisions are made for minorities that people of minorities are not on the boards, they're not at the table. And so why would we do that to our youth? And so having them involved, having those conversations with them, asking them what it is that they need, that's how we keep it youth-centered.
The way that I think it is most important is to understand when we speak about our adolescents or to our adolescents, we should not be lessening what they're going through because it isn't as dire to us as what we think is important. Understanding that just because it's their first crush or just because they aren't necessarily going through like losing a house or having something that we consider as adults to be a massive trauma doesn't lessen the impact on their mental health. It doesn't mean that what they're feeling isn't just as valid as what an adult feels. And I think that, especially as a parent, I have a habit of even detracting from what my kids are feeling because I think I've been through worse or this isn't as important in the moment as what I'm going through. We need to understand youth-centered approach means that the adolescent is experiencing something that is just as important as what we experience as an adult.
And adding on to that is, as adults, it's our job to provide psychoeducation to those kids. The youth and young people are smart and they see the gaps in care and they see where maybe they're not being served right, but they probably don't have the right words for it. And maybe they're struggling with something, but they're showing it in a different way. But it's our job as, professionals in the field and as adults to sit down with them and talk with them about it. Like, yes, you are a minority and this is what that means and this is what you're going to struggle with. And mental health is, something that everyone struggles with at some point or another. So I think adding on to everything that they've said, really just sitting down with them and talking with them. And it's called youth-centered. Put them at the center. It's their life, right?
And to continue off of that, giving kids agency to make decisions for themselves when it comes to their mental health care. Because a lot of times, youth are not considered capable of making those decisions, and so other people make decisions for them, even if what the kid feels, what this youth, what this young adult feels would help them, isn't actually addressed by what is pushed upon them. Oh, this is what we think you need, and not fully listening to what the kids need, and not fully listening to what the teens would be capable of if given the opportunity. By giving them that bit of agency, it empowers them to continue taking that initiative and continue that agency as they move forward into adulthood.
Speaking of agency, Gabe, Kat, I know this is a topic you both have addressed within your communities. How do we ensure mental health resources are inclusive and culturally responsive for youth from diverse backgrounds?
I think from, again, personal experience, when we have counselors or professionals that are coming from a place that doesn't understand what the needs are, it doesn't do us any justice. Specifically, my children are both on the autism spectrum, and I have brought my children to counselors who have no idea anything autism specific. It doesn't do my children any good to bring them to counselors that don't understand the condition. It doesn't do anybody any good to bring people into a mental health field where they aren't living that experience. If they don't know how to even interact with an individual who is in a cultural perspective or minority, it's not going to do them any good to go there. It's just going to further perpetuate the problem.
Yeah. Adding to that is, we need to hire and train diverse and culturally competent staff, but that's not where it ends, right? As organizations, we need to be providing those regular cultural competency and anti-bias trainings, and we need to ensure that the people instructing those trainings align with the population in which they're informing about. So if you're having like an LGBT competency training at your organization, someone who is queer or aligned with that should be teaching the people about it. You really want representation in your organization in every way, but especially in those specific trainings. Another way that we can ensure that the resources are inclusive and culturally competent is by really working on our community engagement. Organizations need to be creating these safe spaces for parents, caregivers, and the youth from different cultural communities to share their needs and concerns. Most communities feel more comfortable meeting in their neighborhoods, so go to them. Don't have them come to your school or to your organization. Find a community meeting spot that's close to them that they can get to and access easily. Another action item could be to have youth advisory councils within your organizations where you can talk to the youth who would be benefiting from your services. That ties into our youth-centered approach, is just having them there and really listening to them. And also make it more accessible for youth. Everyone's on social media. I mean, yeah. Use it. Use it. We all have, sometimes I know we see those like awful ads on there and you're like, okay, come on. And now the trend is bad. But listen, they're gonna still see it. And utilize what you have, social media, current trends, text messaging apps, things like that, anything that you can to get them engaged. And then lastly on this topic is collect and actually use your disaggregated data. So track those demographics and fill in the gaps and create those action projects and have advisory councils and meetings and work to fill in the gaps. We see the data, even through our research, like we can sit there and we can look at it and we can say, okay, there's very clearly gaps here, but what are we doing about it? And I think that's one of the most important things that we could be doing to provide inclusive care here.
Nancy, I wondered if you could address, in the context of the whole population of 14 to 8-year-olds, what were the solutions we found and suggested?
Sure. Thanks, Sarah. So just to give a little bit of background as far as how we conducted our research, we interviewed practitioners, professionals in the field. We sent out surveys. We took those answers, analyzed them, and we really looked at them through the lens of 4 different frameworks. So we looked at them from an individual lens, a family lens, community, and structural. And that's where we really identified solutions that helped inform a little bit of our action work that Kara was going to talk about. So from an individual and family perspective, we really have to work on reducing the stigma. We have to reduce the stigma that we see, hear, and feel around mental health. And so Gabe was talking a little bit about this. We heard from practitioners loud and clear. We need to make resources, education, information accessible. We need to make them digital. And we need to leverage social media campaigns. That came right from the professionals we heard about. And that helped inform our toolkit and that Kara was going to talk about later. When we talk about making things accessible, we have so many agencies and organizations here in Erie County that support mental health, but are they really coordinating resources together? Are they communicating together? Is information flowing freely from them to the schools? I don't think it's happening in the best case that it can right now. So coordination of care between schools, families, individuals, and organizations really has to be seamless. Something else, when we're talking about education, so community schools are one of our best ways to leverage education and support for mental health for our youth. Structurally, we have to look at federal and state support for mental health funding and insurance reform. We heard from Shatiria saying that insurance, transportation, those are major barriers. We have to attack those at the forefront. Better compensation and support for mental health professionals. We need to pay our therapists and counselors what they deserve and for the work that they're doing. And really a clearer system for navigating care for our youth. And so those are hefty solutions, but we're hearing loud and clear from our practitioners and our professionals is what we need in Erie County to really improve and help make resources more accessible for our youth.
I understand that one resource being offered in Erie right now is peer-to-peer support. I wondered, Gabe, could you explain what role can peer-to-peer support play in addressing mental health needs?
Yes, so Erie has several agencies that have adopted this peer support specialist role at this point, and it seems to be working very well for mental health outcomes. So it's working very well, but currently there are only ones for adults. I have heard of a few in the works for youth, and they seem to be on track to start soon and are going very well. But I think that this peer-to-peer support that we see in these that we're having for adult outcomes for mental health is going to transfer very well to the youth as well. So youth are more comfortable talking to people who get it. You know, people who have been in their shoes, are understanding of their struggles, and who aren't judging them. Those are the people that they want to talk to. They want to talk to people who make them feel comfortable and seen and that they feel listened to. It doesn't have to be somebody that's in the mental health field. It just has to be someone that they feel comfortable with. This peer-to-peer support role, it also helps provide early intervention for mental health issues. So peers are often the first people who notice when someone is struggling. And if we can get their peers proper training on this, they can recognize warning signs earlier and help guide their peers toward intervention and towards getting them help. It can also model these healthy coping skills for peers where they can share strategies that work for them. So something that works for youth right now, I know, is like video games. Oh my God, they're really into video games, guys. And they love talking about it too. I run a youth group every weekend, and Roblox right now, crazy big. So if you're in the youth sphere, hit them with that, you'll be real popular. And then, and we've also done some research, and studies show that this peer-to-peer support group has been extremely successful in helping marginalized youth such as LGBTQ youth and BIPOC and neurodiverse youth. And it's a way for them to not only rely on their peers, but to have a safe place to do so as well. So I think these programs, like I said, they're doing very well in the adult sphere right now. And I wholly believe that they're going to do amazing in the youth sphere as well.
Going off this and ways to empower the youth in their own care, I'd like to ask Shatiria and Kyra, what role should youth play in shaping mental health programs and policies, and how can we empower youth to participate?
So, like I said earlier, you have to include the youth in it, right? And so one of the ways that you can do that and make and empower them is by sharing your own mental health journey with them. One thing I like to give the example of my family. My family talks very openly about mental health issues. And so when my daughter was experiencing some things, she was able to immediately come to us and tell us. And she was able to do that because we made this safe space for her, letting her know that, hey, we all deal with this, some type of mental health struggle at one point or another in our lives, and it's okay. It's completely normal, actually. And so what we've seen was because we normalized it, she has normalized it and being able to come to us. Even if the issue was regarding us, we were able to take off the parent, the judgmental part of that and say, okay, this is how you're feeling. Well, what can we do on our end to help? And so we've seen her even be able to have these conversations about mental health with her friends. And that's how you do that. That's how you empower youth to really take part of their mental health.
I will just echo Kyra a bit and talk about how as adults, we like to be validated, we like to be seen, and we like to be heard. And that's the same way with our youth. Being able to come to someone and have them listen actively without judgment is huge, and understanding where they are, meeting them exactly where they are, and just being able to be there for them in a way that they may look at us and to say, like, I'm dealing with an issue, and not necessarily even label it as mental health. I may just be struggling today, and we don't want to put it in a box of, you have this higher level, you need medicine, something is wrong, but just being able to understand the issue that they are bringing to us and just allowing them to feel validated and heard, and being a bit more understanding and a lot less judgmental, because the backgrounds are different. We don't always understand where people are coming from if we have not lived that experience. And even if we lived it, there's often differences. So just listening without judgment actively and allowing them to be seen and heard is what I would say to empower them.
Speaking of seen, Kyra, you've been working with the Erie Downtown Partnership to bring in these interactive kiosks, as well as developing our online toolkit. Could you tell us more about these projects and how technology can be used to better connect with youth?
Absolutely. So buckle up, guys, because this is going to be a while. So I was on a vacation with my husband down in Miami a couple years ago, and they had this digital kiosk right outside of our hotel room. And when I seen it, I was like, ooh, shiny tablet. I'm going to go play and scroll, and I wanted to see what it was about. And so I'm a 36-year-old woman. So what do you think a kid is going to do if they see this, right? They're going to want to touch the big tablet. And so when I touched it, all of these different options came up of things to do around the city, places to eat and things like that. But what really caught my eye was the services listed. So if you were unhoused, there was a service, or there was a button that you could push, and all the services for homelessness and would be there. If you were having a mental health crisis, there was the option there as well. And if you needed shelter, and like all of these different options, food access, it was all just right on this screen. And even if you needed to call the police, it was right on this screen, right in front of us. And I was just like, oh my goodness, this is amazing. Erie needs this. And so that was about 4 or 5 years ago, and I've been like screaming from the rooftops to anybody that would listen to me. And so I joined the Aetna Community Health Council at the end of last year, towards the end of last year, and we were trying to decide on a project. And so one of the things with our group. We had to travel all across Erie County, and we asked the same question to each area that we went. How do you disseminate information to your residents? And some people had answers, some people did not. The Northeast Borough Manager, he said they have a kiosk. They already have one of these kiosks. It's just not interactive at this moment, but he has the capability to make it interactive. And I asked, well, would you be willing to, if we created the information to put on there, would you be willing to put it up there? And he was like, absolutely, without question. And so at the Etna Community Health Council, we invited Emily Fetco from the Erie Downtown Partnership to come in. And when she heard it, she was like, yeah, absolutely. So those will be downtown soon. And it's a wonderful way to connect. And one of the things that I loved about the kiosk in Miami that I saw was that it had different languages. And Erie is such a diverse place that oftentimes when we're talking about accessing care, we're forgetting that there are different languages here and that we need to be accommodating to those languages. And so you can have access to this kiosk despite what your language is. And so I thought that was really cool. And so that brought us to want to create a toolkit. So this was my baby of the project. And so if you go to erieyouthmatter.com, you will have access to an entire toolkit. One of the things on this toolkit is we wanted this information to be spread across Erie County. No matter if you're rural, suburban, or anything in between, these youth are experiencing similar issues. And we want to make sure that we're giving them that access, that we're hearing them. And so how awesome would it be if Northeast and Mill Creek and Union City and the city of Erie had the same messaging going across to everyone? There was in that toolkit, when you first go on there, the very first page when you get to actually the meat and potatoes of it is a link to 988, which is the Suicide and Crisis Lifeline number. So if you go on there and you click it, it will take you right to that. And if you're doing it on your cell phone, it actually should pull it up to go right to making that call for you. And so on that website as well, there's links to how to talk to youth and your friends about mental health. If you're a teenager and you want to be able to talk to your parent about it or your caregiver, it has a link for that, giving you suggestions and topics on how to do that. It has videos on how to deal with stress, mental health in school, mental health in social media, which is a very big component or factor in our youth's mental health these days. There are also stress management and coping skills or techniques that are on that as well. We talk about health insurance and access to health insurance, and it educates them on what is health insurance. I used to work at Highmark, and the amount of times that I would have to educate grown adults on what the difference is between a deductible and a copay and what is coinsurance. That's not being taught at all to these kids. And so we are thankful for organizations like Future Focused Academy who actually do this with our children, right? They help with these lifelong skills that they need to know. In this toolkit, if you scroll down to the very bottom of that webpage, it has two boxes. And on the one box, it's parent resources, parent and caregiver resources. You can click that. It'll take you to our Google Drive that has all of those resources there. And the other one is you can access the entire toolkit. So in that toolkit, it does have social media posts that you can utilize. It has flyers. It has, what else am I missing? Flyers, social media posts. It has videos. It has a lot of videos in there in different topics that you can access. It also has a robust list of services and activities that you can do with your children. And it's the small things that count. And so when you're in there, it has one thing that you can actually do every day, and it's just how to talk to youth about mental health, but you're actually just doing it in a conversation that it doesn't even get labeled as that. So I would recommend everybody utilizing that toolkit, but also going to and sharing this with your kids. If you're a CSD or if you work with mental health, you work with kids, sharing this resource to all youth, to teenagers from 13 to 19. And then one thing that we are also working on building out on that toolkit is our after school and summer programs. There are ways in which to keep kids involved and active. You have Opened Eyes, art program that they have, a showcase that they have. You have ECAT, the Erie Center for Arts and Technology. They have an art program that is amazing. Their programming there is very inclusive of the neighborhood and kids from all over. You have the after-school programs at the Booker T and the Urban Erie Center for Development Corporation. UECDC is their their acronym, but it has so many resources in this toolkit, and so please utilize it. If you have other resources that are available, please send that to us so we can get it added to the toolkit as well. So thank you.
And we have so many stakeholders in the community in the room with us right now. I wondered if you guys could let us know, how can stakeholders work together to make mental health services more accessible to youth in Erie?
Okay, I'll go first. So I'll talk about our schools and education system as a major stakeholder. So I know my titles that I work at Erie Insurance, and that's true, but I previously was an educator. I was a special ed teacher for 10 years, and I taught in higher ed in a school of ed for 10 years. So I was actively in school systems for a long time. We have such a culture of assessment in schools around academics, but we do not screen and assess and really look at mental health in the same way. We need to start as a school system to be focusing on mental health in the same way we triage and focus and look and screen academics. We should be actively screening preventively for students' mental health needs and concerns. We have to stop the waiting to fail model and the reactive model that we currently have in schools. We have to look at it actively as a school system. So if you are here from an education system, a school, please be thinking actively about how can we be proactive and screen and assess and get on the front end of students' needs.
I will continue to focus instead not just on schools, but on organizations who are involved in providing mental health services and the organizations like in local officials and whatnot who help fund those organizations through the county or through state or federal level funding, and people who are interested in that, holding those officials accountable. If you are interested in making sure that policies that improve and streamline insurance accessibility for youth, if that's important to you, make sure, okay, if that's at the state level, what are my state level officials prioritizing to make that possible? Where are the priorities in budget? Where are the priorities in personnel? Where are the priorities in time being focused? Are these things that we are asking for being followed through with? And keeping up on that, because especially in this very, as we see a lot of local media losing the time and capability to play that watchdog role because they're spread so thin, we as community members and people involved in these organizations who are impacted by these policies, by this funding, need to be playing that watchdog role as well, keeping track of what is happening. Are you pursuing these policies? When is the vote on this happening? What can I do to make sure that this happens? How can I advocate with my fellow community members to then take their steps and push their community leaders to pursue this funding, to pursue these programs that can be so impactful.
And on that note, additionally, have micro conversations. I think this is one of the, I'm a big advocate of how micro conversations are an agent of change, one of the biggest agents of change that we can possibly have. Talk to your boss, talk to your coworkers, your peers, talk to your parents about it, guys. Talk with your parents about mental health. That's something we should all do. It's very humbling. Talk with your neighbor. That's how we break down that stereotype that Nancy was talking about, is having those one-on-one conversations and making it seem more approachable. The issue of mental health isn't this overarching thing that none of us can access. It's something that's very real and embedded in all of us, and we need to be having those one-on-one sit-downs with people in our community to enact that change.
And for the parents in the room, how can parents sit down with their kids and talk about mental health?
So I know that it feels embarrassing. I remember being 15 and being embarrassed about every single thing I talked to my parents about. I am 36 and I am still embarrassed to talk to my parents about most things. But if it's an issue, we need to know anybody can talk to anybody about anything and you can get help. If it's embarrassing, there's probably a million other kids that are thinking the same thing, a million other adolescents that are thinking the same thing and are embarrassed. Find the person that will listen, and there is somebody out there that will get the help for our students, for our adolescents. We need to have the embarrassing conversations, and we need to make sure that we're loud and we advocate for ourselves all the time.
I would add as well, I think it's important for our children to see that they're not alone, they're not on an island, they're not experiencing this in isolation, or they're not the first person to ever experience this, and that you as their parent has probably felt that same way or went through that experience. So sometimes it's about humbling yourself a little bit as a parent to help your child feel comfortable and coming to you. So I think that relatability, that understanding, that openness is really important.
I also wanted to touch on the fact that if you have a faith, if you believe in God or whatever deity, not necessarily pushing, oh, we can just pray it away. And really having that conversation. One of the things that my mom used to say to me and still does to this day is that faith without works is dead. And so we can pray about a situation. However, we need to make sure that we are following up with some action. And so she always made sure if I had additional questions on something that it wasn't just that we prayed about it right now. It's okay, we prayed about it right now, and now let's see what else we need to do to continue to help in whatever that situation is.
I would say, as a parent who I have a 15-year-old now, I have open and active conversations with my kids, and honestly, it's in a way where I'm allowing them to tell me, like, every Saturday when we eat, we have breakfast or we talk, and I'm just asking them, like, what can I be doing better as a parent? And often those kind of questions lead down this hole of, like, well, Mom, this week you might have been yelling, or it was something, and then I tell them, okay, well, I might have been going through this, and they don't think of it that way. So it's almost like a reverse way of getting them to open up about what it is that they may be feeling, and you being open about what you may have been feeling. I had a lot going on this week, and sometimes that's a lot for an adult. So having those conversations with your children, it kind of opens up a way that they can tell you anything in those kind of ways. They like to tell us when we're doing something wrong, but it often is just a setup for them to be able to come to you at a later time and have a conversation, because they were able to come to you and tell you something about yourself that they may have thought, like, oh, I'm not able to tell my parents this way. So I just think being able to have that two-way street of conversations with your children in different ways, it allows them to open up in different ways. It's working for me. So I would just suggest that other parents just give it a try, because you'd be surprised that the child that never talks, they'll come and be like, Mom or Dad, this is happening, and you'll be like, oh, okay.
So I do that with, do that with my 5-year-old and my 15-year-old. But the one thing I also will suggest is that when they tell you about yourself, you have to take that information and you have to internalize that. You cannot react in a negative way, because then that shuts down that line of communication. My 5-year-old loves to tell me about myself. So I understand it, but also just making sure that you still create that safe space.
To continue off of both of those fantastic comments, self-reflection, seeing, okay, here's what my kids are telling me, internalizing it. What does that mean for me as a parent? Am I a safe space for my kid to come to? Can my kid trust me as a place that as a person that they can come to with these problems? Or am I even inadvertently making them feel guilty, or making them feel like they can't trust me to not be punished for coming to them, whether inadvertently or not? Like, are you making this a place that is okay and filled with trust and filled with safety? As a parent, you are your kids' safety. That is your role, making sure that they make it from birth to adulthood safely. And if they cannot trust that they can come to you safely, where can you find ways to build that trust, to build that space for your kids to be with you in that conversation? And accepting that even though you are the adult, you do not know everything. None of us know everything, especially when it comes to the internal workings of another person. So you may learn something from your kid that they may not have communicated earlier, or you may learn something about an entirely new subject. Maybe you don't have any experience with the mental health system and learning how to help with depression or anxiety or self-harm. How can you continue learning to help your kids, whether it's your actual kids, people in your community who you are mentoring, people who you are working with, and talk to them like a human? Teenagers especially, but kids of all ages understand way more than people tend to give them credit for. And you don't have to talk down to kids. Maybe if they're like 4 or 5, you may have to use shorter words because they haven't learned those larger words yet. But those same topics can still be addressed with younger kids. They can be addressed by treating them as full human beings, because they are full human beings. And we can trust them to be able to then speak back to us. Oh, hey, yes, I'm feeling this way. Can you help?
Before we move into the Q&A session, if you could share one message directly with young people who might be struggling with their mental health, what would it be?
Mine's is short and sweet, that you are not alone and that you matter.
So You Matter is the reason why the website is called Erie Youth Matter. So utilize it. Go there. There are resources.
Even if the first person that you reach out to does not get you the answer you need, don't stop fighting for yourself. There are adults that you can reach out to. There are organizations that will help you. There is somebody that will listen to you. Don't give up because the first or the second or the third just brushes it off. It's really important to get help. Make sure that you are connecting with the person that will get you the help.
All right, thank you guys for all of that wonderful information. Ben, how are we? Yeah.
If you have any questions, Chelsea has a mic. She's going around. Please feel free to ask.
I've been thrilled with the Erie Community Schools project. have you seen results? I guess your age cohort is probably mostly just the high school, and they've only gone into Erie High, I think, this year for the first time. But how about the kids coming from the middle schools?
Can you repeat? Did you ask, are you seeing results from the community schools?
Yes, and have you encountered them? Are the kids liking them?
Sorry, I think I'm the safest start because I am one of the Erie High Community School Directors. I love what I do. I love that I get to interact with youth on a different level, in not an education role, not a behavior role, just a role of someone else who a lot of my students I look like. I've experienced some of the same barriers that they have experienced. I am a safe space for them, me and my teammates. I have a wonderful 4 other community school directors, and if you come and you just have a conversation with some of our students, what we are working to build with partnerships within the community, within our school system, we have a lot of work to continue to do, but I will say that being in the school, it matters. Education is one thing. The non-academic barriers are extremely important, and mental health is one of those things. I am not a therapist. However, I am able to just have real conversations, and I am not their parents, so they feel safe just talking to me about things, and I give them sound advice and just try to help them through whatever it is that they may be going through. And if I am not that person, I do my absolute best to try to find the support in whatever it is that they're experiencing.
So we have one of our cohort members here, Lori Krause, who also is involved with community schools, so she's going to jump in.
Thank you all. And just want to echo what Shatiria mentioned. I'm Lori Krause. I'm the Senior Director of Community Impact at United Way, and so I supervise our community school directors. So very intimately involved with the community school model. While that wasn't the entire focus of our project with the Civic Leadership Academy, did just want to echo and build off of what Shatiria shared with building the continuum of community schools now from K to 12. As a team of community school directors, we really are working to try and bridge those gaps for students and families. So while we're collectively working with different groups and agencies within the schools, mental health specialists, behavior interventionists, different support staff within the school, as a team of community school directors from the middle and high school specifically, we're building out additional connection points to help families and students transition. So seeing some results in that capacity as we're able to actually follow students from middle school to high school, but I think a little too early on to see, kind of that after effect.
Yeah, hi. My name is Linda Graff. I'm on the Erie School Board. So I want to reiterate the partnership between the schools and the community school directors and how important that is. We are constantly increasing our mental health budget and our mental health resources provided to the schools because we are increasingly, there are more and more students that need them. So, I mean, every year our numbers go up for resources that we need. So we're constantly balancing that and adding more and more resources into the schools, and getting the access to those resources to the students is really where the community school directors really excel of, connecting the students with the resources that are made available.
Hi, my name is Gary Bukowski. I work for Sarah Reed Children's Center. I have a couple questions for you based on the work that you have done. There's 70 people in this audience right now that have heard all the hard work that you've done on this report. Who else to date have you shared your report with? And if you could tell us that, and then what's your plans? Because also in a distant past, I spent time on County Council. County Council needs to hear this because one of the biggest programs within county government is human services. And as I remember, the area that got the least amount of funding was mental health. Because in the old days, it was called MHMR, mental health, mental retardation. I realize it's not that any longer, it's human services. But to get your data into the hands of those people, because they're going to be making a lot of decisions on finances that you're going to need. And at the same time, to, not only county council, but, the federal reps, because, this morning I was with a bunch of people from the state and whatever. Have you sent out this report to them? So they are, because they're getting ready to hammer out a new state budget. And of course, then they're dealing with the people above who are cutting funding for human services and all that in a lot of different ways. So those are just a few suggestions, that's all.
Yeah, so that's why I, earlier in the conversation, talked about how important it is to advocate and follow up, especially with the people who are making the budgets, because that is so important, because that is where we get the funding to have all of these projects. I know we had at least one county council member here earlier. I don't know if he's still here. He might have popped out, but they are aware of the project, and we will continue to be marketing this project and the toolkit that goes alongside it so that these resources are available to them.
Yeah, because one of the biggest problems I've seen is too many reports sit on the shelves and they're never read. And if you don't get it out there, you've got 10,000 other reports.
And that is why we wanted to make sure that the research that we were doing was something that had action items that could be attached to it, that had things that could actually happen in our community and be actively pursued, and not just be sitting on a shelf as this beautiful book of lots of fancy words, but it needs to be followed up, because following up is how we make that difference.
And with the social media piece that you're working on, will that be in the county library? And will it be sort of singled out so people can know it's there for open access to the public?
So anybody who knows me knows I'm a big proponent of social media, and I don't mind going into the spaces and places to talk to anyone about anything. And so now that our toolkit is out here and it's in the public, I will utilize all of my resources and all of my connections to make sure that people know about it. When I joined the Erie or the Etna Community Health Council, that was the very first thing that I mentioned to them, is that this is a way that we connect with youth. And so I will utilize every one of my contacts, which my Rolodex is pretty big at this point. So yeah, we will definitely be making those connections.
We have also shared their report with folks that they have met with in Harrisburg. So wave to Harrisburg, because we are live on Facebook right now as well. And they were going to tune in today too. So the Jefferson is also helping to make sure this report gets out.
Thank you for all your hard work. I was in public education for a long time, and mostly in high schools. There were numerous occasions over the years when we as educators and bringing in parents would recognize that a youth was in crisis, severe crisis. The age of consent is 14 in Pennsylvania. Lots of people don't realize that. So you can bring a 14, 15-year-old in who's in crisis, maybe even suicidal, at least idealization, and the parents are on board, the educators are on board, and the student says, no, nothing. I'm on my own, leave me alone. Did you talk about that at all as a barrier?
So I think that falls in the category of the stereotyping around and the stigma around mental health. And that's something that we touched on a lot in the report, yes. So as I mentioned before, I work with youth, and if I have someone who is like that is around the age of consent, and everyone wants them to get help, but they're just not ready to yet, a lot of times we have a lot of organizations, if not all of them, have protocols in place for that in terms of, okay, let's continue reaching out to this person and let's also work to, like, why aren't they ready for help? Like, what have they heard or what have they been brought up to believe about mental health and their, and the crisis ideation that they feel like they can't go through a recovery process, right? So I think that's definitely something that we had touched on in the stereotyping of mental health. Does that answer your question?
So I think on the flip side of that, having been a former educator working in the school system primarily with high school age kids, I had a lot of young adults that would articulate to me that they were in need of mental health services. However, to get mental health services within the school system, you have to have parental consent. Even though the age of consent in the state is 14, because of funding, they have to have a parent or guardian sign off on a permission slip to grant them access to mental health services. I had some come to me and say, my mom, dad, whoever won't sign this form, but I need services, and they cannot get them. And what I have found in talking with parents is that a lot of the reason why some of them will not allow their children to have access is there is this misconception that if a child speaks to a mental health specialist, OCY gets involved, or that the school or mental health personnel have the ability to essentially 302 or involuntarily admit a child to the hospital. What have you found that to be true, and what do you plan to do to combat that with the parents and help them to understand that while yes, mental health facilitators are in fact mandated reporters, that does not mean that OCY has to get involved. That does not mean that your children will be removed from the home. And it takes a lot to be able to involuntarily admit someone to a psychiatric facility.
Like you, I'm not in the schools anymore, but hearing some of the concerns you shared, it speaks a lot to me about that preventative educational piece that schools need to get out on the forefront with parents. So I think there needs to be a lot more effort into educating parents into here's the services, here's supports we have, here's what it is, here's what it doesn't mean, and maybe ease some of those fears or that stigma or that misinformation, at the forefront. Just like we inform about academics, we inform about mental health supports and services that are accessible, for them. And then I think schools just in general, I think there's ways we can do preventative programming that maybe don't necessarily always involve the mental health counseling, but it can be more interwoven within what we do on a regular basis.
Additionally, those are the kind of resources that can be included in the mental health resource toolkit that we are building. Like a flyer that says, okay, hey, if you sign this kind of document at your school and your school district, here is what it means, here is what it does not mean. Having information that is easily accessible and easily able to be provided to these parents so that they can become informed about making these decisions, that is what this toolkit is built to provide.
Yeah, so this toolkit sounds awesome, and I think that something that focuses on mental health would be like each community center, every school should have a dedicated laptop where kids can go and just access this material, because like a library, a lot of people that need it don't have access to a library. So the more it can be accessible and always be there, knowing and even defining what these terms mean, like, when should I seek professional help kind of stuff. So kids can read it and say, oh my gosh, that's me. I need to do this or something like that would be awesome.
Yeah, a part of that toolkit, it does have those questions of, I'm feeling this way. What does this mean? It does have those, and a lot of the resources that I gathered for the toolkit come from other mental health, national mental health professionals or in organizations like NAMI.
And it's also, that's the reason why developing those kiosks is so important, because it is that permanent fixture that people can reach out to regardless of whether they have access to the internet at home necessarily, or whether if they can find their way to a library, it is in the community with them that they can access.
And just really quickly, this toolkit was not just created by me. I asked youth what they wanted to see in the toolkit. And I had my daughter and her friends sharing this back and forth, telling me suggestions. Well, why are you using this language? We don't talk like that. And so I utilized her in making sure, and her friends making sure that I was including youth. But I want to really press the fact that this toolkit is not just our responsibility. This toolkit is our responsibility. And so if you have those resources, you have those suggestions, make the document, make the flyer, and send it to us and let us put it in there. Because the more robust that this can be, the more people it will be able to reach.
Hi, my name is Marva Morris, and I'm a small business owner. And my cohorts have done an excellent job of this panel, and I thank you. It's made it even more real for me because of the fact that 2 years ago, I hired, through a program, some teenage young women who were having a crisis at home. And had I gone through this cohort and known about the toolkit and everything that's available, I would have been able to handle it a lot easier, because when you have teenagers working for you, and also any employee that has a mental health crisis, it's very difficult for a small business to know how to navigate in that environment, because you don't know whether you're doing something illegal or not, and you don't know how to necessarily respond to it. And so my quest is that we can let this become more available. And Kyra, you know social media, I know you do. So if you can make this more available to small business, because a lot of small businesses don't have huge HR departments where they could access information readily in terms of protecting their employees and also protecting themselves from lawsuits. And these young women, 2 of them, were having problems at home and crying in the office and just dealing with a lot of just mental meltdowns. And so I didn't know how to deal with it. And had I known, I could have made recommendations. And so I'm thankful to my group for putting together this, and myself for putting together this great, this tool. And not only just small businesses, but large businesses as well. So I just would like to make that as a recommendation for our group.
Yeah, that kind of reminds me of like Purple One trainings and things of that nature, where you can be trained on how to recognize domestic violence. And so I think that this needs to continue to be a conversation and see how we can put some action behind that.
Hi, my name's Pierre McCormick, and I grew up in Erie, and I'm a retired business guy who lived elsewhere for 35 years, and we now are active in the philanthropic side of things within the city, and we have a family foundation, and we participate in the community foundation, and we're always looking to support these kinds of issues. This is obviously one of the top 5 public health issues that we're facing. However, our real challenge is not finding organizations or goals that are meaningful, because there's a lot of great missions out there. The real challenge is finding opportunities where things are actually getting done in a measurable kind of way. And I find that many of these things, this in particular, is very, very complex, and there's lots of avenues that need to be addressed. And it's also hard to measure when you may be doing this, but there's substance abuse, and you're not looking at substance abuse. You may be doing something in the school, but you don't know what's going on with the family. as a couple of examples. So to me, the solution, obviously, we always need resources, either from the public, the private sector, or the philanthropic sector. And looking at Erie, certainly the nonprofit and the philanthropic side of things, there's a lot of discussion about coordination. And I would suspect that that system, because it's siloed and there are lots of nonprofit organizations who have missions, but and there's overlap. And perhaps maybe the leadership team could look at this whole nonprofit thing in terms of aligning it with complex issues. It's easier to have activities. We used to have a thing at work where we said, don't confuse activity with accomplishment. And there is a big difference. So I know I'm going on long. What I'm wondering about, I read the report, most of it, and then I noticed at the very beginning it said not AI inspired, or you didn't use AI. I did. I have an advanced AI program, and I was on it for a couple hours, and I couldn't find any hallucinations, as the young people say. And I'm wondering why you didn't, why AI wasn't involved in the project.
So this is something that we talked about at the beginning of the project, and any incorporation of like access to research, things like that. But we ultimately decided that we really wanted this to be something that was true to us as a cohort, and not computer-based, right? So we had a lot of conversations about it actually, and one of the ones that sticks out to me is like, we want our voice in this. We wanted us to be heard as people in the community, as well as we wanted it to be something that we know really well, so that we could have these conversations. We didn't want to just put, yeah, and we felt that the disclaimer was necessary at the beginning of it, simply because of the boom of AI right now and how many people are using it. We just wanted to make sure that it was directly from us and that we're able to talk on it in that way.
I will say that as a part of the writing team, spearheading writing, my biggest piece was the introduction, honestly. And I think that although AI is helpful, and it could have helped us in many ways, we just believed as a group that exactly what you said, just wanting to be able for you guys to understand that we actually put a lot of work into this. This was a long process of meetings and traveling and hours of us spending time together to unpack this topic. We went back and forth for months narrowing it down. So this was really something that we truly believed in. And although we know that we're moving into this AI world and it is extremely helpful, we just wanted you guys to understand that we truly took the time to do the work on this topic, and we are dedicated to actually seeing our cohort project through. So the suggestions that we will get, we're actually taking it into consideration. The toolkit is an additional piece. That was not a requirement of us of this project. This is something that our team and of experts, we just decided for it to be an addition, so you guys can see that we actually really took the time to just do the work and to provide something of quality, but that is meaningful, and that us humans, we actually wrote it. We spent a lot of time writing.
Is it okay if I add something really quick? Okay, so I can speak a little bit to our research approach. So Sarah talked in the beginning in her intro that we did a qualitative mixed methods case study. You use a case study approach when you deal with a complex problem that has multiple solutions and can't be singularly, achieved just through a survey. So AI wasn't going to solve this problem of mental health in Erie County for us. So that's why we had to speak to people who were in the field experiencing it. We had to read the research. We had to synthesize that together to come up with our solutions, and it had to be customized to Erie County's needs. I don't feel like we would have gotten the rich information that we did if we had just Googled, or AI, something like that.
And so I'm all about branding, right? So Erie youth matter. And we wanted to make sure that they knew that by taking our time and not just doing a quick fix. And so that is the overarching thing, is that these kids matter more than just trying to take a shortcut and slap a Band-Aid on a problem.
Hello. There are several of us here today from the County Mental Health Office, and we have a resource guide. Oh, up more, sorry. Oh, yeah. We have a resource guide of mental health, drug and alcohol, intellectual disabilities, housing, and early intervention services that I would love to get to someone, I think to you. So contact information would be great. And how is your toolkit different or similar to the 211 website for social services directory here in Erie?
Well, first of all, it is different because it is actually youth focused. It uses language that they can understand. And 211, of course, is an awesome resource here. But just utilizing every possible resource that's available. My contact information, I can definitely provide that to you after we are done today. But yeah, it's definitely, it gives another step, a more focused a more focused view on those particular issues.
I feel like it's a more collaborative with the youth-centered. I feel like our toolkit used a lot of collaboration directly with the youth, and then that's the reason that it's not more youth-centered, but it appeals more because of the collaboration.
So I come from a big city, and personally seeking services, something that I ran into was the shortages of mental health professionals and an overloaded system. Is this a barrier that came up upon your research as another barrier, that there are not enough mental health professionals or that there's a system that's overloaded?
We did find in rural Pennsylvania, there is absolutely a barrier for that, in addition to countywide, just with the turnover rate and the burnout from the providers and the caseloads being absolutely massive. There's such a high turnover rate. The access to the wait time for even getting into mental health has been massive. That was a big barrier that we found through our research.
I would say, I was just going to add that as we have these conversations about youth-centered and youth-led and allowing them to use their voice in my personal interactions with youth, we often, as adults, we get into fields because we want to help an issue that we went through ourselves typically. So I would say that it's a way to use the voice of our youth that they can see themselves one day being a mental health professional because they overcame some of these challenges. So like teachers, most people, they teach because when they're young, they have that attitude of leading or leadership. So I think it's a way for us to combat that what we're facing of being, underserved and underrepresented by allowing our youth to feel like maybe themselves can be therapists at one point. Maybe they can overcome their mental health issues by talking to somebody and potentially get in the field one day. So I would say that as we talk about youth and empowering their voice and to bring that is a way for us to aid them to be able to come and overcome and share their stories and make something great out of what it is that they're experiencing because we're all shaped by our experiences.
So I, as someone who works in the mental health field here in Erie, one of the barriers that I have seen and that I know a lot of my peers as well has seen is in the public sphere of mental health. The providers are getting paid pennies on the dollar and there's a very high turnover rate for that reason. So we have a lot of providers in speaking in the therapy realm. We have people who are leaving public practices and going to private practice, but then there's a deficit because no one can get paneled with Medicaid. And almost, I'm sure you guys know, like, how many people in Erie County are on Medicaid and need those services. It's overwhelmingly high. But we're just not, in a lot of organizations, treated well in those capacities, and the providers, they just can't do it. It's, yeah, a lot of work. They're overworked. Yeah.
Hi, I'm Brian Graff. I just had a question. And, young people have heard a lot about mental health crisis that they're in. Do you think that they do a good job of self-diagnosing their own situation, like separating out what's normal, let's say teenager anxiety, and maybe a more significant mental health issue? Do we have a feel for that at all in terms of self-diagnosis? Thank you.
I think that depends on how educated the person is in that area. So we all experience anxiety at some point or another, but I think whenever it is something that's debilitating you all day, every day, but you don't have access to see a doctor, it's likely to say, oh yeah, I have anxiety. I mean, you know yourself, right? I think self-diagnosis is something that is it's a hot topic in the mental health sphere, but I think that we also have to go back to what Kenna had said about every person knows themselves and we have our own autonomy, right? So if you're reading the DSM-5 and you're like, oh man, I got everything under the depression category here, I'm checking all the boxes on this, right? And I think youth as well, they're smart, like they know those resources. Something that I see a lot is self-diagnosing in terms of neurodivergency, so like autism and ADHD, because it can be really hard to seek a diagnosis for those. And we see that a lot of people are falling into the categories of some neurodivergency and they need those additional supports, but they just can't access I'm seeing all the providers shaking their heads right now. They just can't access the formal diagnosis. So I think in a lot of cases it is relevant, and I think it's okay, but that's a me thing.
My daughter's gonna kill me. So one thing my daughter used to always say is, I'm depressed, I'm depressed, I'm depressed. And a lot of times she would say this because she would hear other people say it, and not knowing that there are, on the DSM-5, there are things that boxes that you have to check in order to do that. And so it was my responsibility as the parent, who has also studied the DSM-5, to sit her down and educate her on, you're just sad, versus what depression is truly like. And from there, I was able to see her language switch. And then when she did experience depression, we knew it immediately.
I'm an old psych nurse, and I've worked with children and I've worked with teenagers, and teenagers are going through such angst just becoming an adult and trying to figure out, what are the hormones doing? What's my body doing? How am I doing? They can't determine that they're necessarily in crisis. They know that they're going through a lot of changes just because of the physiological and psychological changes that are going on because of their hormones and their growth. But if you give them issues, if you give them questions, if you give them information, they can decide whether they are critical enough or this is just normal and everybody's anxious. But they need information. And the one thing I have learned in working with teenagers, they want to know the rules, and they want to know that you're going to stick to those rules. And they will test you to make sure you stick to those rules. And so sometimes it gets very difficult because you want to say,
you don't know how hard people are doing until you sit suicide watch with a 5-year-old. And then you know that these kids don't know, but he knew enough. He was running in front of cars trying to get hit. He couldn't voice what was going on, but he knew he didn't like what was going on.
Hi, oh gosh, that's loud. This one's a loud one. So I work for the Career Link, so I am kind of the transitioning into adolescence and adulthood side of things at the Career Link. So I'm glad that you guys touched base on that and talking about, them transitioning into adulthood and that being a really crucial point. One thing that I did not hear you guys talk about is about working within mental health and workforce and knowing how to navigate that and working with employers in a way that's effective, that isn't leaving the employer hanging when there are mental health crises, or making sure that the youth know how to navigate that while they're going through their first job. And I do find a lot that I'm not seeing a lot of youth from the ages from 18 to 22 as much when they're fresh out of high school. So I'm kind of wondering, what resources do you have as part of that toolkit for workforce development and things of the nature of like equal opportunity and disability rights and things of that nature? And if you have any suggestions for how to help people navigate that process, including the youth and the employer in that consideration.
So I would say to a couple of your points is that there are some of those resources in there. But there are organizations like GCAC has their Earn and Learn program, and they actually do some education in that program. We have Danielle Randall here from Future Focused Academy, who is doing that age gap that you mentioned. That's where she picks up at. And so if you have those other resources, we need to put those in there too.
But that was kind of a little bit beyond the scope of what we were able to research in these past few months. It is a great opportunity for future research and for combining future resources into the toolkit.
I appreciate
Do we have any further questions? All right, can we give another round of applause to our panel? And can we also have the other folks in this room who are a part of this cohort? Could you please stand for a moment as well? I'm going to ask you all to stay for a picture. But also, if there's anyone in this room or anyone that you may know who's outside of this room who would be a great fit for our next JCLA cohort, we are running out of space. So get them to apply. You can snag one of these on your way out. Next year's cohort will be talking about another giant project that is passed down by these fine folks, and that is population decline in Erie County. So if that is interesting to y'all or someone you might know, please grab one of these on the way. Thank you for coming this afternoon.